recently we had a conversation with Dr. Josh Reimer, who's the president of the Canadian Medical Association, and we just asked her the question, just quite frankly, like how do we get here in terms of doctor shortages and also long wait times, and she put forth two specific key things she thought contribute to it. One of which you've talked about, which is demographics, just the population's getting older, and when you're getting older, you tend to you have to use more healthcare.
Mhm.
And then the other component is the I guess in the 1990s there was a effort to I guess reduce the overall budget and like balance the budget, and
Yeah.
because of that there was some structural things that were done that limited the amount of almost like training of medical students. So she postulated those two things as the key contributors to the longer delays now that we have. But you're actually putting in another structural problem, which is actually the Canada Health Act that hasn't evolved since the 1980s, and that actually creates disincentives for some potential solutions like certain for instance, a certain type of private healthcare to kind of come in and meet the needs that is somewhat disincentivized, right? Am I thinking about that correctly, or is that completely just too naive, Catherine? Would you say that there's another layer to that?
No, the problem is that the Canada Health Act just isn't a good fit for what's going on. And, it depends what you think the solution is. So if you think everything should be kept in the public sphere, then again, the Canada Health Act doesn't address ways in which healthcare is increasingly being provided. And if you believe in more private healthcare, you think that the Canada Health Act is still, a drag on some of the possibilities that we have. So interestingly, in January of this year, Ottawa, the Health Canada Minister of Health federally released what's called an interpretation letter, and these are interesting documents. We've had four so far. This is the fourth one. No other piece of federal legislation that I know of has something called an interpretation letter. And yet we have this one federal statute, the Canada Health Act, which now has four, which is itself, I think, a really interesting phenomenon. And what these interpretation letters originally were set out to do was to clarify, because, when the Canada Health Act was set up, like I said, it was a very small document, very short. So, an interpretation letter was issued by the federal health minister a year after the Canada Health Act came into being, saying, "Okay, here's exactly what we mean by this, that, and the other." So, for example, under the terms of the Health Act, Canada Health Act, can provinces still levy premiums? Again, they were interpretation letters. And increasingly, these interpretation letters have attempted to expand the scope of the Canada Health Act. And it'd be interesting to talk to some lawyers here, because the question becomes, are these so-called Bunny, you're saying these interpretation letters, how much legal force do they actually have? Now, technically, an interpretation letter is just that. It can't change the nature. It can't change it can't change the act itself. So they don't have any binding force. And increasingly, so in 2018, the federal government issued a interpretation letter imposing what they call the Diagnostic Services Act, which came into force 2021. And this essentially said that provinces should publicly cover medically necessary diagnostic services. Some provinces already do that. I think Ontario does it. Just say, yeah, I'm going to do that. A lot of other provinces don't do that. And again, my province is one of them, where if I had to get an MRI done, I could wait 6 months or more, or I could get it done next week. And I could walk to the private clinic and I could plonk down my $900 and I could walk away with whatever scan I needed. And the federal government says, no, this is against the spirit of the Canada Health Act. And provinces are still pushing back. So there are these scofflaw provinces, if you will, that just went for various reasons. And so in 2025, January, Ottawa brought forth this fourth interpretation letter, and they introduced the Canada Health Act services policy to deal with this disjuncture that I just mentioned about other non-physician healthcare providers increasingly providing medically necessary care. So this new interpretation letter essentially is saying that the spirit of the Canada Health Act is that all medically necessary services should be publicly insured. And this is what most people think the Canada Health Act says, except, as I mentioned, this is not what the Canada Health Act actually says. And the reason it doesn't say all medically necessary services, but rather insured services, was to give the provinces more leeway in determining what kinds of services they wanted to insure. But the provinces, I think, with this last letter, the provinces can rightfully respond that that might be the spirit of the Canada Health Act. But unfortunately, the letter of the law is that only medically necessary services provided by doctors or in hospitals have to be covered publicly to meet the terms of the Canada Health Act, because that's what the Act says, right? So you have this really interesting situation in which the Canada Health Act defines insured services as X. And this new interpretation letter says, actually, we want to change the definition of insured services. Well, legally, can you do this, right? It's sort of like saying, well, I've got this contract with a gardening company, a landscaping company to mow my lawn during the summer every week. And then about halfway through the summer, I say, well, by mow the lawn, I actually mean clip my hedge as well, right? So it's an interesting, and again, it's a very political, interestingly political standoff, if you will. It'll be interesting to say. It'd be interesting to see what the provinces decide that they want to do about this.